The business of dentistry. The business of dentistry is constantly evolving. It always has. The pace over the last 5 years seems like an accelerated whirlwind pace to some. To others, they wonder why these changes didn't happen 30 years ago. Put us in the others category. We now have legitimate dental buying groups. We have direct-to-manufacturer purchasing. Amazon is selling dental supplies. Technology is, again, consolidating to a few main companies. Clear aligners have become consumer accepted. Dental consumers are becoming aware and familiar with some of the benefits of dental implants. Whitening has become an entry-level commodity, driving customers, unhappy with the entry-level solution, to an $11 billion a year U.S. market. See, we told you Crest white strips were a good thing. DSOs emerged and expanded as ravenous buyers of existing dental practices. High demand for practices drives prices up. So if you sold your practice or practices in the last 5 years, the price you received was probably directly or indirectly determined by DSOs, even though you may not have sold to a DSO. Ideologic battle lines were drawn between dentists who don't believe you can provide quality dentistry under a DSO model and dentists within the DSO model who provide quality dentistry. DSOs started using their marketing muscle. Solo or small group dental practices were now competing for the same patients in the same geographic region with 1/10 the marketing budget. Unfortunately, most of these solo or small group dental practice owners didn't know a better way to compete other than by using very aggressive price incentives to attract a new patient. Many went down the rabbit hole and never returned. If only they'd read Unlimited New Patients, Volume 3. Now, to be clear, we do not draw conclusions or pass judgment on the various business models used by owners of dental practices. We apply what we know to the various models. As it pertains to attracting dental consumers, we do know patient volume, practice capacity, average first-year new patient revenue, fourth-year ROI, seventh-year ROI, and 12th-year returns for the various advertising methods used. We understand dentists are all different. We have clients who prefer to see 3 patients a day and work out of 1 column. We also have clients who feel pathetic if they can't balance patients in 4 columns simultaneously. So to each his own or her own, we applaud and support the diversity. Despite the panic exhibited by some dentists to the each to his or her own aspect of dentistry is far from dead. You still have a choice in how you want to manage your practice. Fee-for-service is not dead. Far from it. We bet there is a fee-for-service office within 10 miles of yours. You can choose whatever path you want. Dentistry is a wonderful business. Like all businesses, it's just evolving. We had a recession. We're going to look at the good, the bad, and the really ugly about that. Here are some lessons dental practice owners had to learn during the recession. Some learned quicker and easier than others. Some got squashed. History teaches us all, so let's learn these valuable lessons. As sure as you are listening to this paragraph, the U.S. will have another recession at some point in the future. You will want to know how to best navigate through that next recession. Here's the good. Counting practices in existence since at least the year 2000, our client practices grew slightly from 2000 to 2008. Combined, the growth was plus 3%. This was during a time the dental industry was losing 18% of total revenues. The last recession impacted dentistry, there's absolutely no doubt, but our clients gained 21% on the market. Why? What did they do differently to their credit from the rest of the dental industry? The answer, of course, has several steps. This is how we hope you prepare your marketing for the next recession when it happens. Number 1, maintain your budget. One big reason other dental offices lost ground during the recession is because they pulled the reins in on their marketing budget. They cut it. During the beginning of a recession, the last thing you want to do is constrict your marketing budget. You don't have to expand it, but just keep it consistent. Number 2, discontinue niche or elective service marketing spend. Basically, discontinue every singular advertising message. If you aren't giving people 4, 6, 8, or more reasons to choose you in a particular advertising medium, stop spending money on it. Number 3, reallocate nearly all of your properly maintained budget to the core staples attraction to your practice. This would be family dentistry. That's the overall theme. All services, amenities, technologies, conveniences, and public relations assets that support an overall family dentistry message will still work really well during a recession. Number 4, avoid the urge and/or knee-jerk, panic-induced decision to start using aggressive price incentives to get the phone to ring. You do not need aggressive price incentives to attract high-quality new patients during a recession. We just proved it. Through the worst recession since the Great Depression in hundreds of U.S. markets, there is a fable with the tortoise and a hare. Be the tortoise. Here's the bad and the ugly. Remember how cool it was to be a cosmetic dentist from 2000 to 2008? Cosmetics, cosmetics, cosmetics. Everyone became a cosmetic dentist. Every patient had PDS. That's porcelain deficiency syndrome. Consumers had endless spending resources. They would run their credit card bills up, pay their cards off with home equity loans, and keep spending. And you thought it was your charm, good looks, and clinical skill that made you a successful cosmetic dentist. Well, I'm sure some of that may be true, but unlimited cash to spend made you even more charming. So what happened to the dental practices who focused their marketing too heavily toward cosmetics from 2000 to 2008? Well, some practices died completely. It is sad, but it is true. They promoted cosmetics so heavily, all the consumer knew about them was that they were a cosmetic dentist. Then the recession hit. The consumer just needed a good old family dentist now. The consumer went elsewhere. The cosmetic dentist didn't bother telling people they also do regular dentistry. Big mistake. Perception meets reality in both directions. Some of the heyday cosmetic dental practices survived. It took piles of money to quickly rebrand the practice as the go-to family practice in the area. The ship was going downstream. It takes money to get the ship to stop and start moving upstream again. The survivors paid dearly for the niche trap they enjoyed for those 7 or 8 years. So what are the lessons? The most sought-after dental service is family dentistry. This did not change, and we predict will not change. When the consumer has more spending power, you can promote niches with some of your budget, but you never stop promoting your practice as the best choice in your market as a family practice. As a general guideline, never spend more marketing dollars on your niches than you do on the core staples. Even 50-50 is a little too risky in most markets for most situations. In March 2008, we moved our clients' marketing budgets into the core staples of dentistry: family dentistry, services, amenities, conveniences, technologies, etc. Our clients did not want to change. They did not want to let go of the good old days. Some of them left us because they didn't believe us. They went elsewhere. Those who listened beat the market by 21%. We are proud of that. Our clients are happy about it. Every dentist can learn from it. It will apply to your practice someday. It may sound as if we are bragging on ourselves. Technically, I suppose we are. But you can apply the very same principles if you work with New Patients Inc., do your own marketing, or if you are being guided by some other dental marketing firm. You don't have to work with us to be smart managing your marketing budget during a recession. The recovery. Where are we now? We, dentistry, are in the process of getting that 18% back. The recovery started in late 2016. The dental offices who continue to grow through the recession are now killing it. They operate with the same annual marketing budget percentage. Total budget may be a tiny bit higher than 5 years ago because of the growth, but the percentage of revenues is the same. Nobody is spending more money on marketing to take advantage of the economic recovery. Most of these practices are up against capacity restrictions. They're too busy. Some are expanding into multiple office locations. They didn't participate in the recession, and they are getting more than their fair share of the recovery. Good management, good marketing, good result. The practices who dropped their marketing budget during the recession are spending more now to try to make up the ground they lost by not being consistent. This is the price of inconsistency. In dental marketing, you only want to pay for the on-ramp of momentum one time. You hope it lasts your whole career. It should if you are consistent. As a niche, emergencies will lead the way out of this recession. If you haven't yet, consider making yourself more available and your schedule more flexible. What happens to the oral cavity if it is neglected for 4, 6, or 8 years by consumers who tightened down on their dental spending during the recession? Well, more emergencies happen. Emergency dentistry has in the past and will in the future lead us out of the next recession. Having a flexible schedule, online scheduling, online promotion, AdWords mostly, and potentially being able to provide same-day final restorations makes the emergency niche one you might want to initially consider. Adult and senior dentistry is next. Dentists will ask us to promote dental implants all the time. When you write down all of the benefits of dental implants, replacing missing teeth, anchor full or partial dentures, improved cosmetics, etc., you end up with a really solid list of adult or senior dental benefits. If you can combine these with things like sedation and same-day dentistry, or even sleep apnea treatment, you have a proven winner. We do a lot of adult senior implant promotion. To us, this is a market segment, not necessarily a niche. A niche is one thing. Adult senior dentistry is many things. If you played your cards right during the recession, you should be humming right along now. Consumers have their buying power back at somewhat normal levels. It might be time to devote a portion of your total budget toward attracting more patients searching for elective dentistry. How has advertising dentistry changed since Unlimited New Patients Volume 3 was written? Well, DSOs have leveraged their economies of scale. Their buying power and negotiating power is greater than a single owner in one dental practice, or 2, or even 3. Leveraging the economy of scale is their job. It's how they justify their existence to their ownership and shareholders. It should be anticipated and expected. How do they impact you? Well, if you try to promote your practice the same way they promote their practices, you will eventually lose. That war has already been fought, and you've lost. They can provide dentistry faster and cheaper than you can. We didn't say their clinical mastery is any better than yours. We are simply relaying how the dental consumer feels about your practice versus their practices. Minimizing impact on your practice is fairly straightforward. They are all using a reduced price point to drive phone calls into their offices. If you have read Unlimited New Patients Volume 3, or listened to our podcast, or watched our Marketing Summit video series, or have seen Mark and I on stage, you know we make a big deal out of the two market segments. Basically, DSOs are promoting to the half of the dental market who will choose a healthcare provider for their family primarily based on a reduced introductory price point. If you realize those are not the type of patients you want in your office anyway, for the most part, segment your market properly and focus your marketing dollars on the other half of the market. The DSO down the street won't really impact you too much if you do this. The DSO marketing will be alienated the very market segment you want. In most markets, all you have to do is go get it. Here's an important point. If anything, the constant barrage of price deals from multiple different dentists in your market makes you stand out above the crowd if your advertising doesn't use a deal, i.e. price reduction, to get the phone to ring. The more deals the surrounding moms see equals more differentiation for you. The moms who won't choose a healthcare provider for their family, based primarily on a price incentive, will choose you. That's almost half of all moms. Specialist advertising has changed dramatically. The ice age of independent ontists is upon us. Specifically mean the orthodontist, the periodontist, the endodontist, the prosthodontist. Pedodontists are safe for a while. Oral surgeons are safe, but they're also feeling the pinch. General dentists have been keeping more of the work in-house. More general dentists are bringing specialists in under their own roof. More specialists are shedding their own overhead and simply going from GP office to GP office to fill out their schedules. That makes sense. Orthodontists aren't going down without a fight. They raised $4 million to nationally promote the idea that orthodontists are better at aligning teeth than general dentists are. The ads were trying to convince the public to seek out orthodontists directly. $4 million. Poof. Gone. For the orthodontist, endodontist, periodontist, and prosthodontist reading this, we are not anti-specialty. We are just saying there is more than just the writing on the wall. It's not our wall and not our crayon, so don't blame us for sharing what is going on. The transition is happening right now. There will always be a demand for professionals with your training, experience, and wisdom. Nobody is suggesting otherwise. But the way the patient makes it to your skilled hands is changing. It is changing dramatically. If you haven't faced this head on, you should. It is time. Everything in dentistry changes. It always has, it always will. Some are fearful of the change. Others embrace the change. Everyone has a choice.